Good morning. Good morning, everyone. Thank you for joining us on this meaningful and historic day, not just for Florida State University, but for children and families across the state. I am Dr. Alma Littles, Dean of the Florida State University College of Medicine, and it is my honor to welcome you here today as we celebrate two landmark achievements: the codification of the Florida Institute for Pediatric Rare Diseases in Florida law, and the launch of the Sunshine Genetics Program, which will offer whole genome sequencing to newborns across the state. I want to begin by thanking President Richard McCullough for his unwavering support of these initiatives. His leadership has helped make today's announcement possible and reflects Florida State University's deep commitment to advancing health and science for the public good. I also want to recognize Representative Adam Anderson, whose courageous leadership and personal story are at the heart of today's celebration. Representative Anderson, your vision and tireless advocacy have brought us to this moment, and your work will change lives for generations to come. To the families and patient advocacy groups who are here with us today, thank you. Your presence reminds us why this work matters. You are the reason we pursue innovation and compassion in pediatric care. The College of Medicine is proud to be the home of the Florida Institute for Pediatric Rare Diseases. Under the leadership of Dr. Pradeep Bide, the Institute is rapidly growing into a statewide hub for rare disease research and clinical care. With initiatives in genome sequencing, genetic counseling, pediatrics, and gene therapy development, IPRD is not only advancing the science, it is delivering hope to families who have waited far too long for answers. And now, with the Sunshine Genetics Program, we take a major step forward, bringing cutting-edge genomic medicine to newborns across Florida, starting from the very first days of life. Thank you again for joining us this morning and for supporting this important work. It is now my pleasure to introduce the person whose leadership has made all of this possible, Representative Adam Anderson.
Wow, what an amazing introduction. Thank you, Dean Littles. It's always such a pleasure to be back here on campus at FSU with my fellow Knowles, and it seems like every time I'm here, we're celebrating another major milestone in advancing our shared vision of leading the nation in genomic medicine. And we're here to celebrate another big leap in the right direction. We're celebrating the signing and the funding of HB 907, the Sunshine Genetics Act. It's truly a historic milestone that's giving Florida a once-in-a-generation opportunity to lead the nation in genetic and precision medicine. And it's formally codifying into statute the Florida Institute for Pediatric Rare Diseases. And so this bill really not only marks the beginning of the next generation in healthcare for Floridians, but it also ensures that the IPRD will go on to live longer than anybody here in this room. I want to start by expressing my sincere gratitude for my friends Senator Colleen Burton and Senator Jim Boyd, who were exceptionally gracious throughout the process as this legislation was moving. And equally as important, they were rock-solid partners in the Senate. Throughout the process, the bill received unanimous bipartisan approval in every committee stops. There were 7 committee stops in total to get this bill to the House and the Senate floor to be finally approved. And it was passed with dozens of co-sponsors. I want to thank Governor DeSantis, not just for signing the bill and approving the funding, but for his overall support of our mission of quickly diagnosing children and seeking cures for pediatric rare diseases. And of course, I must thank our amazing House Healthcare and House Education staff. As some of you know, that this was the first bill that I personally wrote from scratch. So they had the very challenging job of turning my ever-changing drafts into something that's actually actionable that people can vote on. And they had to put up with me over the last year or so as we worked together to get it right. And my wife, Brianne, and my oldest daughter, Kaylee, are here with me today. If you want a little flavor of what that was like over the last year and a half or so, feel free to ask them. I'm sure they're going to share some colorful stories of what it was like living with me as we were getting this done. But the truth is, a lot of people worked really hard to get this bill across the finish line. But the real work is just beginning now, and that would not be possible without the tireless dedication that I've seen from the folks here from the FSU College of Medicine, who will lead the newborn screening program statewide. So thank you, President McCullough, Provost Jim Clark, Vice President Patterson, Dean Littles, Dr. Bidet, Dr. Ledbetter, and the whole IPRD team. Your work today is providing hope to countless families, but it's just a matter of time before that hope is transformed into cures for rare diseases. People are often surprised to learn that there's as many as 10,000 known rare diseases that affect over 30 million people across the country. That's more than, or just about 10% of the population of our nation, but it's more than the population of the state of Florida, and 80% of these diseases are genetic in nature. People are often terrified to learn that it takes on average 4 to 5 years, plus 7 or more trips to specialists and overnight stays in a NICU to diagnose a child with a rare disease. And sadly, many of these children pass away before they receive any meaningful treatment at all. But the Sunshine Genetics Act solves that problem. It establishes an opt-in newborn screening program to offer whole genome sequencing at birth, free of charge, and ending the diagnostic odyssey for children who are born with genetic disorders. Today, our state newborn screening program screens for just 60 conditions, and only a handful of those are genetic. But this new program has the capability to screen for as many as 600 conditions that have actionable treatments. And that list is growing each and every day. Florida ranks #1 in the nation for higher education. We have some of the best universities in the country, and each of our top universities are working hard in their own unique way to advance genetic medicine in the state. But there's no formal mechanism for inter-university collaboration among our universities. The Sunshine Genetics Act solves that problem. It creates a national consortium that will be led by FSU, UF, USF, FIU, and Nicholas Children's Hospital, uniting our top universities, our top children's hospitals, and industry experts to collaborate and drive innovation and research to cure these complex diseases. Through our universities, Florida will lead the future of medicine. The genomic medicine industry is estimated to reach $100 billion in just a few short years. And right now, Florida only has a very, very tiny sliver of that industry. Right now, we're missing out on a huge opportunity for our state. But the Sunshine Genetics Act will solve that problem. Florida is now the first and only state in the nation to offer a newborn screening program that's this comprehensive. One that will attract the best talent in the industry, the most brilliant minds in medical research, and usher in the future of medicine to Florida. But most importantly, Thanks to the work that's being done here at FSU, the Sunshine Genetics Act will save lives. Of course, we can't do this without the appropriate funding, and in a minute, I'll be presenting a big check for $7.5 million that will continue to fund the Institute and is what I consider seed money to launch the Sunshine Genetics pilot program. And we're going to continue to fight for additional funding to grow the program, but we can't do it alone. So today I'm calling on biotech firms and gene therapy firms, genetic medicine companies, and nonprofits throughout the country. Partner with us. Help us to fund this program. Help us to grow the program. Join the consortium. Be on the right side of medical history, and help us bring whole genome sequencing to every newborn child statewide. So I'd like to invite up President McCullough, and we will present that big check.
Thank you, Representative Anderson. I also want to thank you and Brianne, Kaylee, for your family's courage in turning personal heartbreak into purpose. This work honors your son, Andrew, whose short life continues to inspire so much good. A lot can be done by saying yes. I know I've told this story before, but when Adam came to me and said, would you be interested in starting an Institute for Pediatric Rare Diseases at Florida State? I said, absolutely, absolutely. And the reason, it's of course strategic, but it's these kinds of diseases are ones that are not the things that are being taken up. I'm not saying anything negative about pharmaceutical companies, but these are small populations is the way that it's described. And so these, along with other orphan diseases, become left out. And so, and they're hard problems. And it takes a long time to solve them. They're perfect for universities. That's what universities do. We take on long, hard, complex problems where we have the time and the patience to attack these problems through applied research, translational research, and basic research. And that's the hope that we have with this institute. Representative Anderson's vision to impact lives in this area is unparalleled, and we're grateful to be his partner. I know there are a lot of families and advocacy groups here today. I thank you all for being here. Your presence is important. It means a lot, and it also tells us how important this work is. I want to thank Representative Anderson for his leadership, and I want to thank the strong support of the Florida legislature and Governor DeSantis that the Sunshine Genetics Act is now law. As Adam said, this law codifies the Florida Institute for Pediatric Rare Diseases at Florida State. That means that the Institute is part of state law, and it's here to stay. I have to tell you, I've been in Florida for almost 4 years now. It's not easy to get those 3 signatures. It's a lot of work to get that done. But the support has been unwavering. And it's been strong, but it still takes fight. It still takes fight. It still takes advocacy. It still has us talking to the leaders of our state to help them to understand why this is so important for the state of Florida to lead. The Sunshine Genetics Pilot Program offers Florida parents the option of free genome sequencing of their newborns. With just a few drops of blood, serious health risk before the symptoms can appear can be detected, and that provides information for treatment that can save lives. But you have to understand that this to get to where we are today and the work ahead of us, this doesn't happen by accident. You know, millions and millions of dollars were invested to sequence the human genome, and there were people who thought that was nuts. And then and once it was sequenced, people looked at it and said, "Huh, we're like 98%, the same as a, chimpanzee or something like. This didn't tell us anything at all." But in fact, it told us things that we couldn't even imagine. And the things that came out of it were incredible. So that's sort of one discovery, the ability to sequence the entire human genome and then understand that a single molecule change can cause devastating disease is unbelievable. And that's what came out of genome sequencing. And then another discovery was CRISPR-Cas9. CRISPR-Cas9 is the defense mechanism that bacteria use. It's their immunological system to protect themselves against being invaded by viruses. And what it does, I would call Jay up to give you all the actual, what it actually does, but I'm going to give you my sort of, fifth grade explanation. Basically, it has machinery that you can use for gene editing. And so if you have one base pair that's in the wrong place, that's an addition, which has caused a disease, the hope is that using this CRISPR-Cas9 mechanism, it can go and clip out that one molecule and repair the genome, leading to the possibility of people being cured of genetic diseases. But to do that, you have to sequence the genome. You have to get the information. So the power of the Sunshine Genetics Pilot Program is to sequence the genome of babies to start to understand the basic science and try to detect these diseases for treatment sooner rather than later. And the genetic testing will be performed right here at Florida State University in a new facility, the Florida Institute of Pediatric Rare Diseases. We can't thank the state of Florida enough and Representative Anderson for his tremendous commitment to do things that will transform lives, but also decades from now could make huge, huge impacts, not only in the state of Florida, but the world. And so this is a big deal. It's a big deal. Now, I have to tell you, I enjoy coming to these things and unveiling big checks. That's a wonderful, wonderful part of this too. Without that, it's just been incredible, the support that we've been given. But again, it's Representative Anderson and others like him that fight the good fight. When we first started down this pathway at the beginning of session, people said, I don't know, the budget's tight, IPRD, I don't know. maybe you get a little bit, but not very much, and I don't know about the sunshine. We were getting all that, talk, and we just kept after it. We helped, you helped, everybody, Clay, Ingram, our lobbyists, we just kept after it. And there were big people supporting it, like Jim Boyd, for example. It's a great Noel. And it continues to pay off. And we are honored and proud to be entrusted to do this work here. Because when I came to Florida State and I looked at the College of Medicine, I said, this is a transformative time in genetics research. And what we should do is buy high-throughput genomic screening machines. I told Vice President Patterson, go buy a bunch of high-throughput screening machines, genomic sequencing machines. She said, we don't really have that many people doing that stuff here. I said, I don't care, we're going to build it. That's what we're going to do. We're going to do that. We're going to combine that with data science, and we're going to start working in the area of gene editing and genome sequencing and data science and AI, and that's what we're going to work on. And so it was a bit of a build it and they will come. And about a month or two later, I ran into Representative Anderson, who asked me about this idea. I was like, man, this is perfect. This is like manna from heaven. I mean, this is exactly what we want to do strategically. And it's also a place that we can separate ourselves out from, some of the other places that do, genomic sequences for neurological diseases or whatever, like they do at the Stanley Center at the Broad Institute. It allows us to do something, and to do something that is incredibly important. And the mission is absolutely worthy, and we're so proud to be a part of it. I want to thank Dean Alma Littles for her leadership of the College of Medicine and her steady support of the Institute. I think, it requires leadership at all levels of the university to make this happen. To rally the faculty, to hire the people, to build the facilities, and she's just done a tremendous job, so I really appreciate it. I also want to recognize Dr. Pradeep Bidet. I remember after talking to Adam Anderson, I was like, do we have anybody that can do this sort of stuff? I mean, we need to hire somebody like yesterday. And I remember personally getting on the phone and calling, the guy at UMass and all these other people around the country that Adam had turned me on to, and I was trying to, frantically search around for people that we might be able to bring here. And then one day, someone told me about Dr. Bidet, and I was like, oh. Again, this is all fate in some sense. And so thank you for your leadership. We're growing this thing. We're starting to, this has created a buzz nationally. People are going, man, what is going on at Florida State University? They're doing genomics research at Institute for Pediatric Rare Diseases. I'm maybe at some other university, but, maybe I'm alone doing that. I want to come be part of an initiative that has the support of the university administration top to bottom, and resources, or the promise of resources to do something in the space and power and quality to make it happen. So this thing is really taken off, and we're really, really proud of this effort. It means a lot. It's also why that Florida State University is committing $2 million from our budget to support Sunshine Genetics program. The funding will help cover the cost of sequencing and make the work possible. I didn't even know I could sign checks. See, it just keeps getting better. Thank you. Florida University is building one of the most forward-thinking medical research environments in the country, and this is central. This center is central. This institute is central to what we're doing at the College of Medicine. Again, I want to thank Representative Anderson, his family, Governor DeSantis, Florida Legislature, President Albritton, and Speaker Perez, Jim Boyd, others for supporting this work and believing in it, and a shared commitment to every child in Florida is incredibly meaningful. Now it's my pleasure to introduce the director of the Florida Institute of Pediatric Rare Diseases and national voice in this critical work, Dr. Pradeep Bide.
Good morning. Thank you all for coming, sharing with us a momentous day, not just for Florida State, not just for the College of Medicine, not even just for the Florida Institute for Pediatric Rare Diseases, but for every child and family all across Florida. I will take this opportunity to expand a little bit on what Dr. Little said, Representative Anderson said, and President McCullough said, and give you a few highlights of what is happening at the Institute for Pediatric Rare Diseases and how Sunshine Genetics Act will make that so much more transformatively significant. So you see the checks being unveiled a few times, and that's great, but we're actually making progress. The Institute began February 2024, about a year ago, and we have made progress in 5 key programs that serve our overall mission, which is to develop innovative tools for diagnosis and treatment of pediatric rare diseases. We have established a whole genome sequencing lab that's going to get CLIA/CAP certified in a matter of months, hopefully later in August. This lab will offer, once it's certified, diagnostic testing for children and families all across Florida. And our partner in this is Quest Diagnostics, and thank you for coming today. More importantly, this will be the heart, the hub, or the core of the Sunshine Genetics whole genome sequencing program. Up to 10,000 newborn genomes will be sequenced right here at the College of Medicine at the Institute's new facility. We're also establishing a viral vector and genome editing facility. Dr. Boris Cantor, who is here, just joined us a week ago from Duke University to lead this effort. Our ultimate goal is to develop new or innovative tools for delivering gene therapy for pediatric rare diseases. We have established a master's program in genetic counseling, so we hope to welcome our first class in the fall of 2027. We're recruiting a director and genetic counselors. Any of you here interested, let me know. We also have a robust rare disease research program. We're supporting 20 projects across FSU, across about 3 colleges, maybe 5 departments. The research spans pediatric brain tumors to cardiomyopathies to speech and language disorders. The goal ultimately, again, is to serve the mission of discovering new tools for diagnosis and treatment of pediatric rare diseases. Finally, we also are expanding our pediatrics clinic. Dr. Pepper is going to lead that effort. We will become, in the North Florida, maybe in the state, the first clinic dedicated for undiagnosed and complex pediatric diseases. So all this towards the core mission of pediatric rare disease research and treatment. Just to repeat, none of this would have been possible without support from so many individuals, groups, but most importantly, FSU leadership. Dr. Stacy Patterson was among the first to give us, actually I'll mention the number, $1.25 million to buy the very first whole genome sequencing equipment that President McCullough mentioned. thank you. And then Provost Clark's office came to help us with the genetic counseling program, and you just saw the check from President McCullough. So this has been really a concerted effort. Dr. Little is here every single day. I go to her and ask for something, and it always happens. So we are all really grateful for the FSU leadership for making this possible. But most importantly, it has been said many times, but not enough, Representative Anderson, your commitment, your vision, your initiative, and the passion, that's what made this possible. Finally, a few words about the Sunshine Genetics program. You heard a little bit. Let me give you a few details. Maybe you get a big picture of what we're planning to do. So this is about whole genome sequencing of newborns. What that means is the entire genome of a baby will be sequenced right here at the Institute so that genetic causes for potentially debilitating disorders can be found well before the symptoms appear, so that the families and their doctors can implement management or therapy early. The reason early intervention is important is in many cases, that's the only time it's going to be effective. So even though the treatments exist, if they're not done early, they will not be effective. So the whole genome sequencing gives the families that information so that they can act on it as soon as possible. Second is the testing reports will be sent to the families, parents, so they can act on them as necessary. And it's voluntary, and there is no cost to the families, because state funding will take care of that. But this is not only about diagnosis and treatment. This is about the future. This is about research. So from consenting families, the sequencing data will be stored, will be anonymized, de-identified, so nobody can trace it back to the child or the family. It'll be secure, stored in a secure database and distributed via secure channels to scientists at accredited Florida universities, so they can continue the research, find new ways of diagnosis and treatment for years to come. So the research mission of Sunshine Genetics is really critical and crucial. And we are still developing these plans, so things will change. But what is already clear is the vision. Thanks to Representative Anderson, the vision is to make Florida the leader in pediatric precision medicine, where care is personalized, preventive, and proactive, so that every child in Florida will have access to the best that science can offer today. Thank you again for coming, and I am now going to invite Dorothea Lance from Miami, who is mother to a rare disease child and also represents Prader-Willi Syndrome Association of United States, and a Knoll, an FSU grad. Thank you for coming.
I normally don't have notes when I speak, but I was given a time limit, so thank you so much. Like Dr. Bidet said, my name is Dorothea Lance. I am a native Miamian, an FSU alum, and so unbelievably excited and honored to be here with all of you today. I'm also the Director of Community Engagement for PWSA USA, which is a national 501 that works with families throughout the country that have a loved one living with Prader-Willi syndrome, which leads me to my most important role, and that is mom to Hunter, who will be turning 8 years old later this month, in about a couple of weeks. He's usually with me, but unfortunately, we had to leave him home so he could continue to receive therapy services over the next few days. So again, I'm so pleased to be here with all of you today as we launch this groundbreaking public health initiative. While the goal of the Sunshine Genetics Act may seem simple, the promise of early genomic sequencing for every child born in the state of Florida will impact our community for generations. Now, I can tell you as the mother of a child living with a rare disease, I can attest to the fact that early diagnosis and early intervention is key. It is key to end suffering for parents and create a better opportunity and a better quality of life for children. I can also tell you that I spent the first almost 3 years of my son's life basically as a resident at Nicholas Children's Hospital in Miami, Florida, where he received 5-day-a-week therapy schedule, PT, OT, speech, and the beginnings of ABA right around the time that COVID shut us down. It is the difference in the rare space. It is the difference between life-saving treatments for so many in the rare disease community. And by identifying genetic conditions like PWS at birth, this legislation will give our Florida doctors and our Florida families what they need the most, and that is the precious commodity of time. So we know that rare disease impacts 1 out of every 10 individuals throughout this country, and there are estimated 30 million Americans living with a rare disease. What does that look like in Florida? It is estimated that there are somewhere around over 2 million Floridians that are living with a rare disease. And over the next 5 years, we will be projected to have 70,000 births of children living with a rare disease. So 70,000 babies, what does that look like? That's 70,000 babies in the state of Florida who will now have a chance to combat rare disease, and in many instances, before any symptoms show. These are the babies who can receive life-altering treatments, therapies, and drugs so that they have a chance to live a normal life like so many of us in this room take for granted every single day. These 70,000 families who won't have to battle a typical 6 to 8 year diagnostic odyssey that is so prevalent in the rare disease community. These are families who will have an opportunity to celebrate life and the possibilities of life instead of mourning the unknown. This program represents an extraordinary leap forward for Florida families and for children like mine. The potential to detect rare, ultra-rare disease and countless other conditions at birth offers families like ours real hope and a better lifelong outcome, and really makes Florida a leader that hopefully states throughout the country will follow. Over the past few months, I've had an opportunity to meet with advocacy organizations throughout the country, and I've spent a lot of time in Washington, D.C., advocating for PWS and other rare diseases. And when I speak to people about the launch of this program, their mouths drop. It is such an incredible opportunity and an honor to be a Floridian and FSU alum and be a part of this amazing healthcare initiative. So thank you so much, Representative Anderson, for all the work that you're doing and for your family's time in making sure that you have the ability to bring this forward. For Dr. Bidet and for everyone at the FSU's team, thank you so much for the work you're doing. You are literally changing lives for generations, including my family's. Thank you.
So again, thank you all for coming. I don't want to end this without mentioning that Florida State University is training the future physicians and physician assistants and psychologists and social workers, engineers, and other scientists here who will be able to learn from what's happening with this institute and participate in the research of what's happening here at Florida State and around the state, and carry this on into the future. In case you didn't notice, we're really excited about this here at Florida State University and the College of Medicine. So again, thank you all for coming. Please continue to enjoy each other's company, enjoy the refreshments, but this ends the program for today, so thank you all again.